Jackson. My name is Jenna. I'm going to be your student nurse for today, and I saw your chart before I came in and noticed that the doctor has requested for a tracheostomy suction and care to be done. So now that I said that, can I please see your ID badge? Thank you. Can you say your full name and date of birth? Thank you. Do you have any allergies I should be aware of? Thank you. Okay. And also, I'm going to auscultate. I'm just going to listen to your lungs to confirm the doctor's order. Okay. It does sound like you're going to need a suctioning, and along with that, it will come with care. So that verifies the doctor's orders. And are you in any pain? Okay. You're not in any pain, so we won't need any medication for the procedure. Okay, sounds good. And then just to let you know how the procedure will go is I will be just suctioning out your trach and then basically cleaning it out. This is done because it'll help you breathe better. That is why we do it. And what we do is exactly just that, suctioning with a suction tube and then cleaning it out around there and giving you a brand new little tube to go in there as well, okay? All right, perfect. So now that that's done, I'm gonna hand hygiene again. I'm gonna raise your bed up. Okay, and also just to let you know, I'm gonna provide privacy by closing the curtains and the doors, okay? And I'm gonna have you also know that if you need to stop this procedure at any time, you can just raise your hand up. And also if you are experiencing any respiratory distress, we will stop the procedure, okay? All right, perfect. Okay. All right, we were at a semi-Fowler's position. Perfect. So I'm gonna hand hygiene. Okay, I'm gonna place the drape on you. Should go right below your chin. Okay. All right, now that we have done that, I'm going to just, you know what, Mr. Jackson, I'm also going to be setting this to 150 mmHg. While we're waiting for that to start up, I am gonna just put my gloves on. Okay, now it should have been a little bit now. I'm gonna check for the suction. Okay, the suction is good. All right, and while that's going, just gonna place that right back there. Okay, and then while we're doing that, I'm also just going to open this, take my box out, take my sterile gloves out, take the suction tube out, discard of this in the trash can, which I have, and also now I'm just going to take the saline. I'm gonna lip it. The expiration looks good as well. I'm gonna pour some in here. Okay, now I can take off my gloves. Okay, now I'm gonna hand hygiene. Okay, now I'm just going to, okay. You're doing okay, Mr. Jackson? All right. Do my PPE and my gloves. Put my sterile gloves on. I would do this without contaminating the sterile gloves, as I might have just done. Throw that out. Okay, with the sterile procedure still being in place. This is my sterile hand, this is my non-sterile hand. Okay. So with my non-sterile hand, I'm opening the package, pulling it out with my sterile hand to keep it sterile. Okay. And okay, and I'm going to connect the tube to it as well. All right, I'm just going to remove your oxygen mask, and now I'm just going to dip this in the saline. Okay, while suctioning intermittently. Okay. Now I'm just going to, okay, you know what, before I do that, suction, okay. I'm just gonna use an ambulating bag on you to give you some more oxygen since we have removed the last one. About 3 to 6 breaths, take a deep breath. We would go a little slower than this in a real situation. Okay. Okay, now that we've done that, All right. Now I'm going to place this tube in here at a predetermined length. Okay. I'm not going to be oculating as I'm putting it in. I'm just putting my thumb to the side over here. Okay. All right, now I'm just gonna rotate it. And, okay. Still okay, Mr. Jackson? If you are not, please raise your hand. Okay, so Mr. Jackson's still doing okay. So now I'm just going to take it out as well. All right. Okay, now I'm just gonna ambulate you, Mr. Jackson. Some more deep breaths. Okay, I would do that slower in a real situation. Okay. I wouldn't actually touch this in a real situation, I'm just fixing it. Okay. Now that I've done that, I'm just gonna clean it out. Okay, Mr. Jackson, do you feel like everything's a little bit more clear? All right. If it wasn't, we would be doing this repetitively in the same act that I just did it. For now, I'm also just gonna clean out your mouth, okay, for any mucus. All right, thank you. Okay. Now I'm just going to, now the procedure's done, I'm going to wrap this around my hand, take it off. Okay, I'm also going to be taking this off as well. Taking off your old tube, okay? Just gonna putting the oxygen on really quick because it's gonna be a little bit of time before I come back. Okay. This is the trash over here, trash. Okay, hand hygiene. I would also be throwing this out in the trash. Hand hygiene. Okay. Now I'm going to take my tracheostomy. I'm going to open it away from me, as I did with the other one. Okay. I'm going to take out my sterile gloves. I'm also going to take my saline, the same one I already checked the expiration on. I'm going to lip it because I know I just used it. Open the cap, pour some. You know what, I'm going to go around, pour some in here. Okay. All right, and then hand hygiene. All right, and now I'm also going to take the new inner cannula and dump it in. Okay, throw this out. Okay, hand hygiene. Now I'm gonna put the sterile gloves on. Okay, all right. Okay, we don't need that trash. Okay, so now I'm gonna take the drape, shining side down, we're gonna place it here. This is my sterile field. I'm gonna take all my things out and put it here. Okay. It would all stay on the sterile field. Okay, so now that we have that, I am just gonna, this is my sterile hand, this is my non-sterile hand. I'm gonna remove the oxygen, and I'm going to be placing the new cannula in here. Okay, make sure it's in place, good, okay. Now I'm also going to be taking with my sterile hand the Q-tip, dipping it in the saline solution, and I'm gonna be going around, discarding it, okay. Now I'm going to be going in the saline again, coming around, cleaning it, discarding it, okay. Going the saline, coming around again, discarding it, okay. Going in the saline, coming around for one more time, discarding it, okay. And I'm also gonna, since I have one more left, clean the oxygen mask. Sometimes it gets a little dirty in there. Discarding it, okay. Now that we have everything a little bit wet from cleaning, we're just gonna dry it off with a dry gauze. Okay. I'm also going to discard of that. I'm going to place a new drapery. Okay. And also I'm going to place a new strap here. It would go around the neck. Since this is our neck, we're just gonna put it here. It would be Velcroed as well, if I had one. All right, okay. Now I'm just gonna have you move your head. Can you flex your neck to make sure it's comfortable? Okay, perfect. I'm also gonna reapply your oxygen. All right, great, thank you. And then, so now that we're done with that, I'm also going to complete oral care at this time as well. Okay, so we're gonna come do some oral care. Okay, and then I would discard of this. Okay, do you need anything for your lips? There you go. Okay. All right, so now we're done with that. I'm just gonna take this off. Perfect. Okay, we're gonna discard that. We're gonna discard of all this. Procedure is done. Okay, I would have discarded that too, or used it for another time. Discarded the gloves. Okay, I'm gonna hand hygiene, and then also I'm going to listen to your lung sounds. You know what? Let me put your bed back down to a workable, not workable height, but back down to how you will be when I leave. Are you still feeling okay, Mr. Jackson? Anything's discomforting? You feel any pain? No? Okay, perfect. All right, the bed is low. Now I'm just gonna listen to see if it is all clear. Okay? Okay, Mr. Jackson, it appears there's no adventitious sounds. It appears everything sounds clear. I'm gonna put an oxygen 2 saturation, oxygen O2 saturation on your finger as well. Take that. Okay, your oxygen levels look within normal range as well, so thank you very much. Okay, is there anything else I can get for you? Put it near you before I leave. Okay, are you comfortable? Would you like me to adjust anything for your comfort? No? Okay, and you're not in any pain? Okay, thank you, Mr. Jackson. I'll be back to check up on you.